63 years ago, the pill hit the market and it remains the most popular choice of contraception in Australia. Yet for many women, seeing the doctor to renew their prescription is so pricey, it's enough to stop them taking it. The cost of contraception can be a bitter pill to swallow. But for women in New South Wales, it just got that little bit easier.
We've listened to the millions of women who said it's too complicated, too expensive and sometimes too difficult to access what is a basic health need for half the population.
From Saturday, women in New South Wales aged 18 to 49 can get a 12-month supply direct from a pharmacist, skipping the need to revisit their doctor for a prescription. As long as the type of pill is low risk and they've been taking it continuously for 2 years.
We know that it works and we know that it's popular with women.
Queensland and South Australia have also ditched the need for a visit to the GP, and paying for both a doctor's appointment and the medication can be costly. A 3-month supply of the pill can cost anywhere between $10 and $30, plus as much as $115 per GP consult, which means over the course of a woman's life, the pill can cost up to $20,000. And for some, the cost is too much.
1 in 4 women in Australia have had an unwanted pregnancy. This is actually a risk that the Australian healthcare system can't afford to carry.
New South Wales trialled the scheme for a year, involving more than 500 pharmacies who provided more than 2,000 consults.
There were many women who had very successful interactions with their pharmacists during the trial.
But GPs say bypassing doctors is a mistake.
What a GP does is entirely different to what a pharmacist does. We might talk about doing sexual health checks. We might be planning for families and doing fertility checks. Women, as they get older, that's where we really start talking about all of our preventative health care. GPs do so much more in that consult than just write a piece of paper.
But in a cost of living crisis, is it time we made the pill more accessible and more affordable for women?
The resupply of the oral contraceptive pill is a beautiful example of how pharmacists can partner and complement the service of a general practitioner when they're not available and they need to continue on their oral contraceptive pill, because if they don't and they miss a dose, they are at risk of an unwanted pregnancy.
Dr Isobelle Smith is an endocrinologist specialising in women's health and is with us now. So, Isobelle, we heard there women in New South Wales can skip the GP and go to the pharmacist for their pill under certain circumstances. Is that a good idea?
When someone comes to see us, they're never seeing us just for one issue. We're not a shop. Someone doesn't come in and say they want the pill and we go, okay. We're talking to them about all these other things going on in their health. Have they had any abnormal bleeding? Are they up to date with pap smears? How's their mental health? I think a lot of doctors, including myself, do have concerns that, this is not the best solution for our healthcare system and patient care could be impacted.
Isobelle, you've kind of explained what I'm after here, but when I got the pill, my memories are a lot of the doctors didn't really ask me any questions at all. It was a bit tick the box and, you're in and you're out, and I didn't know my doctor. I went to a bulk billing place usually because it was the last thing on my list. I'm not convinced in that situation that a doctor gave me more information than a pharmacist could. So what is it that a doctor can give us that a pharmacist can't?
The pill, for example, has had a really bad reputation, I'd say, in the last 5 to 10 years because of health experiences, exactly like you've said. The risks haven't been explained. They haven't had follow-up. Maybe this is a reflection for medical system to go, why is it that people are wanting to see a pharmacist over a GP? Every time someone comes in with a medication, we should be re-reviewing, is this appropriate? Have you had any new complications? Is your situation the same? It's also about continuity of care. The beauty of good health care is that the doctor and the patient, have that established relationship, and maybe some conversations that, with a pharmacist they've never met before over a counter, they're not going to really feel comfortable. Oh, by the way, I've had this kind of weird discharge and pain when I've been having sex. That would probably require a little bit of trust. So if, for lots of people, maybe seeing the pharmacist could be right, but there's always going to be people that's not appropriate, and I think that's really where our concern is. Why is it so hard to get into the GP? Why is it that it's, people can't afford, they can't have access? I think that's my other big concern that I don't think is being talked about enough.
One of the problems that this is trying to solve that you just mentioned is the cost of going to the doctor and, then going to buy this medicine. But in Canada, the UK and Ireland and France, access to contraception is completely free. So should it be free here too?
You know, I would say so. I think contraception is, you know, a critical part of healthcare. And we know that, you know, the highest group of unplanned pregnancies is in young women, often with, you know, poorer access to healthcare, poorer health literacy. This could be helping with this problem, but it's reactive. It's not looking at the underlying issues with the healthcare system. Why is it that, you know, Medicare rebates for, you know, GPs hasn't been increased? Bulk billing practices are just pretty much not sustainable unless you're doing that crappy 5-minute medicine that is, you know, not satisfying and giving good outcomes for the patients or the doctors. So yes, you know, back to what you're saying, yeah, I think it would be great if contraception was, you know, free, especially for people, you know, with lower access, you know, not in as good financial situations, you know, especially that younger demographic.
Dr Isobelle, thanks so much for your time.
You're welcome.